Everyone, and welcome to this webinar on the benefits and results of complementary integrative medicine therapies. This is a workshop, a webinar organized by the MV Health Working Group, for which myself and my colleague Dolores Montserrat are the co-chairs. And this health working group is established by the European Parliament's Committee on Environment, Public Health and Food Safety. We'll be discussing today a very important issue, including the latest EU and WHO-related action in the field. The topic of today's event is quite relevant for the European Parliament, as this has been shown in the previous work we have been done in the matter. One of the main lessons from the COVID-19 pandemic is the importance of working together and in an intersectorial way, and this was more highlighted in the field of health during this pandemic. This is the only way we have to respond to the needs of our citizens, and in particular to all patients, improving our health systems and improving the health outcomes of our populations. Following the pandemic caused by COVID-19, the European Union recently launched the EU for Health program. That is the European Union's health program that has 5.1 billion euros available for the health field. In addition to COVID-19, we face many other pandemics caused by other diseases with high mortality and high morbidity, which also requires our attention, such as cardiovascular disorders, musculoskeletal disorders, metabolic diseases, and cancer, among many others. For this reason, it is very important that we are discussing here today complementary integrative medicine therapies. And as we'll see during this webinar, they can help us to give better answers and solutions to our citizens' health problems. So we, myself and the co-chair, Dolores Montserrat, we hope that this webinar will be very useful for everyone. I'm just going to explain briefly how this will work. This panel will be followed. Now we're going to have panelists with 10 minutes intervention maximum by each, and this will be followed by a Q&A session, open firstly to interventions by colleagues, MEPs, and if time allows, to intervention by the audience. And the last webinar shows that everyone that wants to participate will have that chance. In order to ease the proceedings, as we are here in WebEx, please use the raise hand function in order for you to ask for the floor. I would also like to inform you that this event is being web streamed and it will be recorded and available at a later stage. Presentations and speakers' biographies will be made available at the ENVI Committee website at the European Parliament's website, and the summary report will also be available after the event and published at the Parliament's internet website. So we now move to the first presentation, which is an overview of CIIM therapies and complementarity with conventional medicine. What is the scientific and clinical evidence? And to give us this, we invite now Dr. Toni Nicolai, who is the Secretary General of EUROCAM in Belgium, to have the floor for 10 minutes for your presentation. So Dr. Ton, now you have the floor. I hope you're able to share your screen. Yeah, great.
Yes, my presentation is about integrative medicine, and I called it the best of two worlds. The structure of my presentation goes from terminology until WHO policy and integrative healthcare. I would like to start with terminology because there can be some confusion. Traditional medicine is, for instance, traditional Chinese medicine, traditional Indian medicine, Ayurveda. Complementary medicines are medicine is all healing methods that do not belong to mainstream biomedicine in the Western world. And traditional medicine and complementary medicine overlap because traditional Chinese medicine, Ayurveda, is considered as complementary medicine in the West. So WHO uses the term traditional and complementary medicine in general. But increasingly, they use the term traditional, complementary, and integrative medicine. You can see a screenshot on the right-hand side. It all has originated by the citizens' demand. Around 25% of the general population in Europe use TNCM. That is 1/3 of GP visits, and the TNCM use is 2 to 4-fold greater among those with health problems, more common among women and those with higher education. What are the reasons for citizens' demand? That is an increased personal responsibility for their own health, preference of a more holistic view of health, of more gentle natural therapies, and a dissatisfaction with conventional Western biomedicine because of its unpleasant side effects, because the treatment has proven to be ineffective for their medical condition and their long-term drug regimens. Here you can see a list of therapies in this area. There are about 150,000 MDs with the qualification in TNCM and about 160,000 other practitioners. In response to the growing demand of TNCM among citizens, some academic health centers in the USA started to offer these treatment methods to their patients. And at the same time, they explored the benefits and assess the evidence of these traditional and complementary medicine. At the moment, this academic consortium includes over 70 academic centers in the USA, including very renowned ones like Harvard, Yale, Stanford, and Mayo Clinic. Also in Europe, the number of academic centers providing integrative medicine is increasing. What is integrative medicine? This is the definition. It is the practice of medicine that reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, makes use of all appropriate therapeutic approaches, healthcare professionals and disciplines to achieve optimal health and healing. In fact, it is the best of two worlds. It is traditional and complementary medicine and biomedicine. And what do these worlds look like? They use different models, and these models can complement each other. First of all, the biomedical model. It has their focus is how can we combat disease? How can we counteract or fix it? And the treatment is eradicating, managing a physical problem, destroying infectious agents, cancer cells, and blocking biochemical pathways. That is very effective. So this biomedical model has several strengths, especially for acute and surgical emergencies, life-threatening conditions, serious psychiatric conditions, conditions with irreversible tissue damage or requiring medical technology. But it also has its limitations because it has a limited ability to change the course of chronic disease. There is a need for blocking these biochemical pathways. That means long-term drug regimens. Also, other pathways are affected, so adverse effects, and other symptoms require more drugs, leading to polypharmacy, which is a big issue, especially for the elderly. Now, about this model of traditional and complementary medicine. The strength of this model is that care is individualized and aimed at restoring the person to a healthier state of being and to improve their resilience. It can be used as a first therapeutic option, and it reduces the need for high-impact, high-cost interventions with potential adverse effects and long-term dependency. And in case of infectious diseases, it can reduce the need for antibiotics and the problem of AMR, and it is mostly low cost. But also this model has its limitations. TNCM therapies can only play a secondary role in serious life-threatening diseases like cancer, sepsis, because protection of life itself has always the highest priority. Biomedical interventions are then indispensable. But also in conditions that are too far out of balance for the self-regenerating capacity, biomedical medication is necessary to reduce harmful symptoms to an acceptable level. There are about 56 integrative medicine health professionals and 95 general practitioners per 100,000 inhabitants. I told you there are increasing numbers of university hospitals, but there are also professorial integrative medicine chairs in several countries. What can it do in chronic disease? In chronic disease, lifestyle changes, of course, are the primary approach to the management of chronic disease. You know that. And also prevention. And some chronic disease can even be reversed by lifestyle changes alone, like diabetes 2, for instance. But if lifestyle changes alone are not sufficient, then these TNCM modalities come into play because they are aimed at stimulating the organism's healing capacity and can strengthen their resilience. And if that approach is not sufficient, then the biomedical approach is necessary. What is the evidence base of integrative medicine? Well, the evidence has increased significantly over the last 20 years. There's a fair amount of evidence for the effectiveness. You can find it on PubMed and also in the virtual health library of PAHO, the Pan American Health Organization. Here, an overview of the scientific studies in PubMed about complementary and integrative medicine, the hits on your right-hand side. The Virtual Health Library was set up by the Pan American Health Organization. They brought together a group of researchers and experts in the field to develop clinical evidence maps, and they used high-quality PRISMA guidelines and MSTAR2 criteria to analyze the quality of the included systematic reviews. These criteria are the most rigorous criteria research has today. And these evidence maps can be found on their website. I would like to show you that there is some similarity between integrative medicine and organic agriculture. In agriculture, the use of herbicides and pesticides have to be limited to improve the quality of crops and soil. And the same principle is applicable to the treatment of humans and animals, in fact. Lowering the use of high-impact drugs to combat disease while giving preference to treatment that promotes health and resilience of humans and animals. And that actually is what integrative medicine can offer. More accurate would be the term integrative healthcare, because medical care is just one of the many factors that contribute to citizens' health. And in our vision, integrative healthcare would integrate a continuum of services like health promotion, disease prevention, wellness, and health maintenance. Just a few words about the World Health Assembly and World Health Organization. The World Health Assembly is the decision-making body of the WHO. They adopted several resolutions that urges traditional and complementary medicine to be integrated into health services. They published a booklet on traditional medicine strategy that is aimed to support member states in harnessing the potential contribution of TNCM to people-centered healthcare, and also to promote the safe and effective use of TNCM through the regulation of products, practices, and practitioners. WHO also published benchmarks for practice and training in specific modalities, and they added a chapter on traditional medicine to the ICD-11. 2 years ago, they published a global report on TNCM. WHO is now halfway through implementing the WHO traditional medicine strategy. You can see here the growth in the number of member states with a national policy on TNCM. And here on the next slide, you can see the distribution by WHO region of member states with national policies on TNCM. And here you can see the European region, 53 member states, and out of these 53, 11 countries have legislation and national policies on TNCM. If we focus on European Union, then you can see that 8 out of the 27 member states have national policies and legislation on TNCM. The United Nations had a declaration in 2019. They commit to scale up their efforts to explore, to integrate safe and evidence-based traditional and complementary medicine within the health systems, particularly at the level of primary healthcare. And I would like to conclude with a supportive statement by Dr. Tedros Adhanom Ghebreyesus, who is the WHO Director General, as you will all know. Countries aiming to integrate the best of TNCM and conventional medicine would do well to look not only at the many differences between the two systems, but also at areas where both converge and to help tackle the unique health challenges of the 21st century. In an ideal world, TNCM would be an option offered by a well-functioning, people-centered health system that balances curative services with preventive care. Thank you. This is the end of my presentation.
Thank you, Dr. Toni Nicolai, for your very thorough presentation. It was a clear example of why me and my colleague Dolores Montserrat aim for this health working group, which is to bring more evidence to the decision-making process here in the European Parliament for us as legislators, and also to share this knowledge with all the different players. So now, further on in our webinar schedule, we had now planned to hear about the effects of CIM on strengthening immunity, especially when addressing COVID-19. A very interesting presentation by Dr. Georg Seifert, who is a professor of pediatrics in the Department of Paediatric Oncology and Haematology in Charité Berlin. But unfortunately, Dr. Georg Seifert is on a mission in Brazil and is unable to join us due to unstable internet connection. So I now proceed and move on to our next presentation by Professor Simona Dragan. Professor Simona is a professor of Internal Medicine and Cardiology at Victor Babes University in Timisoara, Romania. And Professor Dragan, I would like now to give you the floor for your presentation for 10 minutes. You have the floor now, and I hope you're able to share your...
Okay, but my share content button is not active. How should I do this?
Yeah. You're a host here in my screen. You're a host. I can now try to make you a presenter. Maybe that's gonna help.
I think it's now you have presenter privileges. Can you?
Okay. It's active now.
You have 10 minutes now. Thank you very much.
Great. Thank you.
Okay, you can. I hope you're able to see it, right? Okay.
From here, you can proceed. Thank you.
Okay, thank you. So this is about prevention and integrated treatment of heart disease, which is a very common condition, as you well know, and also diabetes. I am a cardiologist, and I have an interest in integrative medicine. I've been part of Cambrela, and that's why I am doing this presentation. So first, I will talk about the cardiovascular disease continuum and the risk factors, then about CAM use in cardiovascular disease, cardioprotective effects of the Mediterranean diet, integrative therapies and current guidelines, and future perspective. We talk about the cardiovascular continuum when we refer to all the cardiovascular diseases, starting with the aspects of prevention, which are always underlined by modifiable risk factors and non-modifiable risk factors. And I can cite them here for you: obesity, diabetes, dyslipidemia, hypertension, smoking, alcohol misuse, unhealthy diets, physical inactivity, and psychosocial factors, or are the palette of modifiable risk factors, while a genetic predisposition, race, gender, and aging are the non-modifiable ones. So until we keep them under control, we are in the domain of prevention. As they progress, they determine target organ damage, cardiovascular diseases, atherosclerosis, and in this stage, we can contribute to regression of the disease by certain therapies and modalities. And when the target organ damage is also in the symptomatic phase, so we have heart failure or myocardial infarction or strokes or peripheral arteriopathies, then we talk about retarding the progression of the diseases. So that's why we have to address this whole palette with all the different modalities in order to be useful to our patients. CAM use in cardiovascular disease was the topic of a very thorough review in 2012, published in 2012, which included 27 other reviews, and it refers to, it's in fact a meta-analysis, which refers to CAM use worldwide. It refers to Europe, including countries like Italy, Spain, and the UK, and also Hong Kong, China. It refers to the United States, and also to Australia. So the prevalence of use of CAM was between 4 and 61% throughout these studies. And the most important ones in cardiovascular diseases were herbal therapies. The preferred ones were herbal therapies, and also mineral and supplements, minerals and other supplements used by the patient. What I have found and considered interesting for making a point in this presentation is healthcare use in cardiovascular disease in the US. This was published last year, and it is a sample of 26,000 people, most of them the general population, but also people with cardiovascular disease and individuals with high risk but without known cardiovascular disease, so all these categories. And this sample is relevant, considered by the National Institute of Statistics of the United States. It's relevant for the whole 246 million population of the United States. So these are graphs referring to the general population, to populations with cardiovascular disease and with cardiovascular disease risk factors in terms of utilizing the healthcare services. And see that whether it is about addressing a general practitioner, a medical specialist, a chiropractor, a naturopath, a homeopath, whether addressing mind-body techniques like mantra meditation, mindfulness, spiritual meditation, yoga, in yoga not, but in all these other ones, the people with cardiovascular diseases and with cardiovascular risk factors were prevalent. So more people addressed these services, whether a GP or spiritual meditation or a chiropractor or a specialist, than the general population. And I mean by this that they were not reluctant in addressing these therapies. Indeed, they considered them important, especially mind-body techniques. And yoga was more prevalent in the general population, but also in the other ones. Tai Chi as well in the population with cardiovascular diseases, and Qigong as well. So this is a sign, because I use American statistics because they are made last year. They are this wonderful, extensive review was contributed by Gustav Dobosch, who is a well-known CAM practitioner in Germany. And he was considered an expert, and that's why they addressed him to do the statistics. But this is relevant for a population where addressability and the attitude of the general practitioners and of the specialists towards CAM is very considerate and allowing, as compared to the European GPs and medical specialists who are quite reluctant for the use of this. I mean, they allow it for their patients, but they don't see any benefit. They don't consider the patient as important as the Americans do. So the well-being of one patient is a personal problem. So that's why it's so important to take into consideration these studies. The Mediterranean diet, I consider it reloaded, because since the year 2000, when it was proven that eating a Mediterranean diet lowered cardiovascular risk 4 times compared to the Western diet, so much to the extent that the Western diet appears to be recognized by the immune system mistakenly as a threat, because the main components of the Western diet are inflammatory, and they lead to increased oxidative stress and endothelial dysfunction. And that's why the Mediterranean diet does exactly the opposite and was recommended since 20 years ago. And 4 years ago, another study on the effects of the Mediterranean diet was published, which compared the normal diet with the Mediterranean diet, adding nuts or adding extra virgin olive oil. And it demonstrated even further that these addings to the normal diet are recommendable. What made this more interesting was the polyphenol intake, because a sub-study of this trial demonstrated that the polyphenol intake from the Mediterranean diet was responsible for decreasing inflammatory biomarkers, which are the main, mainly responsible for, together with the risk factors for inducing and complicating atherosclerosis. So when we talk about cardiovascular diseases in general, we have the risk factors and their effect on the cardiovascular system, which means increasing insulin resistance, increasing sympathetic activation, leading to endothelial dysfunction, increasing inflammation, leading to atherosclerosis and oxidative stress. And what is interesting, in the last 20 years, and extensive research has been done in the field of bioactive molecules with cardioprotective effect. And these are parts of the diet which are recommended in integrative medicine, because integrative medicine in cardiology means dieting, exercising, supplements, herbs, and mind-body techniques. So starting with these first ones, the diets, the presence of bioactive molecules in cardio and their cardio. Oh, excuse me, what have I done? I don't know what I have done. And their cardioprotective effect is very important. And the classes are polyphenols, flavonoids, carotenoids, omega-3 fatty acids, and sterol phospholipids. So all of these intervene in lowering what I have presented before, that is increased in cardiovascular disease, and not only in cardiovascular diseases, but also in diabetes. So starting from the oral cavity to the large intestine, going through liver, muscle, pancreas, and adipose tissue, these bioactive molecules, besides doing, improving in the endothelial function and decreasing oxidative stress and inflammation, also contribute to an increased insulin secretion and beta cell integrity, and also to decrease gluconeogenesis. All these are very important in diabetes. So in fact, evidence is growing, but of course, for the task forces who are behind the guidelines of practice, the proofs that they are giving us are not enough, because we all work according to guidelines, whether we are cardiologists, whether we are GPs, and then we look into the guidelines. The Mediterranean diet made it into the guidelines with class 1A levels of evidences. So we don't need any more evidence for this. This is the highest level of evidence that, yes, we need to use a Mediterranean diet. And plant-based food patterns are also recommended at class 1 level B evidence. What is important in the present guidelines, they have been edited in 2021 and presented at the at the Congress of the European Society of Cardiology, is that in prevention, in cardiovascular prevention, treatments are recommended. And that we should address, as doctors, psychosocial stress. We should address also environment, air pollution, and climate change interventions when we are talking about prevention. So the person is viewed as an individual with personalized treatment decisions to which he can contribute, but also at population level, which is very important. And the individual level interventions are lifestyle interventions, which refer to physical activity, body weight, nutrition, and psychosocial factors besides the specific
Simona,
treatments.
I'm sorry to interrupt,
Yes.
but I would kindly ask you to conclude in 1 minute.
Yes, I will conclude. Yes, I know. But compared to the other slide I have shown, in diabetes, Mediterranean diet is class 2A level B. And in the lipid guidelines, functional foods with phytosterols have made it to the guidelines, reduced-rice nutraceutical as well, and omega-3 polyunsaturated as well acid. Compared to this, the hypertension guidelines in the US are more permissive. They relate to hibiscus tea, for instance, healthy drinks, pomegranate juice. Regular physical activity includes yoga, and reducing stress means mindfulness or meditation. This is in the guidelines, transcendental meditation, mindfulness, which is not in the European guidelines, while complementary and alternative traditional medicines are considered not having enough proofs to make it into the guidelines, although they are used at a large scale in Africa and China, for instance. That's why, having said all this, I consider that cardiovascular patients desire often an integrated approach because they do not comply well with medical therapies and complain of medical side effects. That treating physicians need to be knowledgeable about the evidence for and against intervention, such as diet, exercise, supplements, herbs, and mind-body techniques, and that the patient-centered, evidence-based approach of discussing the risk-benefit profile of these approaches will allow a more open dialogue with our patients and hopefully improve compliance and outcomes. Thank you very much.
Thank you very much, Professor Simona, for your very thorough and excellent presentation. I will now give the hosting to my colleague, Dolores Monserrat, and she will be chairing the second part of this webinar. So Dolores, you have the webinar now.
Thank you, Sara, and thank you to all of you, and welcome to all the panelists. So now we move to the presentation to Dr. Jorge Pérez-Calvo, who is the Director of the Center for Biological Medicine and Integrative Oncology Unit in Barcelona. So Jorge, you have 10 minutes for your presentation. Go ahead and welcome.
Please unmute yourself. We cannot hear you, Dr. Perez.
Yes.
Yes.
I am going to share Can you see?
No, no lo estamos viendo. We cannot see on the screen. Now, okay, perfect.
Okay.
Thank you.
Okay, thank you. First of all, I would like to thank the members of the European Parliament for their presence and attention, and the ENVI Health Working Group for providing me with this opportunity to help spread the word about complementary and integrative medicine, and thus help improve the patient's quality of life and choices. In this brief talk, we will introduce the application of integrative medicine to the cancer patient, a particularly needy group. Let's talk about integrative oncology, complementary medicine in the prevention and support of the oncological patient. There is no disease more traumatic or with greater psycho-emotional and physical impact than cancer. It has tremendous burden on society and our health systems. Cancer is responsible for more than 25% of total deaths in Europe and is the leading cause of death between the ages of 45 and 65, a number increasing every year. 1 in 2 men and 1 in 3 women will develop cancer within their lifetime. In 2020, almost 4,400,000 new cases were diagnosed and almost 2 million died of cancer in Europe. These numbers are projected to increase by 70% in 2040. The total cost of cancer was 199 billion euros in Europe in 2018. Cancer is a multi-causal disease with an uncertain, debilitating prognosis and illness progression that leads to multiple sequelae and pathologies. According to the VCAN5 study from the National Cancer Institute of France, 5 years after cancer, 64% of patients suffer from sequelae. 50% are limited in their physical activity, and 49% suffer from fatigue. These causes of cancer are multifactorial and mainly linked to lifestyle, which implies that they could be modifiable. Such causes are not addressed in conventional oncological treatments, which focus mainly on tumor reduction. One of the main contributions of integrative oncology is to provide a medical supervision of these causes and lifestyle changes, which is essential for patients to prevent, defeat, and avoid post-treatment cancer relapses, always as a complement of conventional treatments. Through lifestyle supervision, nutrition, emotional and psychosomatic support, and application of complementary medicine, integrative oncology can play an important role in the quality of life and clinical evolution of the patient. Some of these causes can be seen in this slide. At least 51% of oncology patients admit to taking some type of complementary treatment. According to other sources, the percentage is much higher. So in pediatric oncology, this percentage gets to 80%. But what is integrative oncology? It can be defined as the coherent combination based on scientific evidence of complementary medicines with conventional treatments in a personalized and holistic approach, always showing consideration and respect for conventional cancer treatments, but targeting people in their wholeness, body, mind, and emotions, spirit. Integrative oncology is not synonymous with alternative medicine. It does not reject conventional medicine, but instead tries to complement it. It does not accept either any alternative treatment uncritically, but rather incorporates complementary treatments that have demonstrated sufficient scientific or clinical evidence to benefit the patient. Integrative oncology improves health, biological condition, quality of life, well-being, and clinical outcomes. It also seeks to empower the patient so that he can prevent recurrences, help him in his emotional, psychosomatic stress, and make him an active and conscious participant of how to optimize his condition for prevention, treatment, and post-treatment of cancer. Evidence of the need for complementary treatment is that the United States includes integrative oncology services in the public health system through 45 national cancer centers. 60% of these centers have integrative doctors. The most common therapies offered are 91% consultations about nutrition and food, 73% acupuncture, 84% dietary supplements, 67% herbs, and 69% meditation and yoga. In pediatric oncology, integrative oncology has been part of service portfolio for years and is the indicator of excellence in care. In Europe, some public hospitals already offer integrative oncology services. These include the Charité University Public Hospital in Berlin and the Paediatric Oncology Center in Sant Joan de Déu in Barcelona, among others. The most widely used complementary therapies in integrative oncology are nutritional medicine and food, traditional Chinese medicine and acupuncture, intravenous vitamin C infusions, ozone therapy and oncothermia, nutritional supplements.
Just one moment. You have to pass the slide because you went atrás, you went behind.
It's not passing?
No, now. Perfect. No, now this one you put it already.
Okay. Okay, we are in slide 6, I think. Yeah, we are talking about the most widely used complementary therapies that is used in integrative oncology, which are, it's the slide, nutritional medicine and food, traditional Chinese medicine, and acupuncture, intravenous vitamin C infusions, ozone therapy and oncothermia, nutritional supplements and herbal medicine, emotional stress support, homeopathy, yoga and meditation, exercise, and aromatherapy. Certain therapies have shown a very good quality of scientific evidence, such as nutrition, acupuncture, TCM or traditional Chinese medicine, and oncothermia. Others have lower quality of evidence for not having randomized double-blind studies, as these are very expensive. That is not to say that these therapies could not be used as palliative care or adjuvant treatment in cases of good clinical efficacy, when there are no better options to be offered, which is frequent in oncological processes. Now I will briefly highlight some treatments for their efficacy, safety, and scientific evidence. Nutrition in cancer. There is significant scientific evidence on foods that pose a cancer risk and foods that have the potential to fight it. It's logical to procure cancer-fighting foods intake, plant-based, and avoid or limit foods that can predispose to cancer, such as processed red meat, alcohol, or others, as is recommended by the World Cancer Research Foundation, the American Institute for Cancer Research, the World Health Organization, and other reputable sources. In addition to promoting the prevention and fight against cancer, adequate nutrition and supplementation can reduce inflammation, detoxificate chemo and radiotherapy effects, increase energy, mood, and immune strength of bone marrow and vital organs. To sum up, nutritional medicine can improve adherence to treatments, quality of life, and chances of survival. Ozone therapy as oncological adjuvant treatment. Ozone therapy improves oxygenation of tissues and has a powerful systemic antioxidant effect. This allows cancer patients to improve their quality of life and reduce toxicity of cancer treatments. Among other beneficial effects, ozone therapy can reduce refractory pain and healing delays of post-radio and surgical wounds. Ozone therapy can also combat fatigue and reduce lymphedema, all this without side effects. Oncothermia. Based on modulated electrohyperthermia, oncothermia has a good level of scientific and clinical evidence. More than 400,000 treatments are carried out annually in the world. It's used in several university hospitals in Europe, Asia, and the United States. It effectively helps in the reduction of tumors without side effects. It's complementary with chemo, immune, radiotherapy, and surgery, increasing effectiveness as many studies have shown. Some examples of tumor reduction can be seen in this slide. Traditional Chinese medicine and acupuncture are treatments with high scientific evidence. They help in different conditions of cancer, such as pain, nausea, and vomiting, serostomy, hot flashes, fatigue, anxiety, depression, and insomnia. In the main Chinese cities, conventional cancer treatments are usually accompanied by traditional Chinese medicine, herbal medicine, qigong, massage, diet, and acupuncture as support. In the public Hospital of Sant Joan de Déu Pediatric Cancer Center in Barcelona, there is an integrative oncology unit. Inspired by pediatric oncology reference centers in the United States, such as Boston Children's Hospital, Memorial Sloan Kettering Cancer Center, Dana-Farber Cancer Institute, or Presbyterian Children's Hospital, where integrative oncology and acupuncture had been part of the service portfolio for years. These centers have planned integrated complementary treatments such as acupuncture, nutrition, massage, or aromatherapy. In final conclusion, in an attempt to prevent the rising tide of cancer and improve the quality and prognosis of the cancer patient, a framework of support for complementary medicines and integrative oncology is required at the level of the European institutions. Thank you for your attention.
Thank you very much, Dr. Perez-Calvo. I would like to thank for your outstanding presentation based on many years of excellent scientific studies and professional experience. So now we are going to move to the last presentation in our today's webinar. A representative of WHO, the researcher Nils Fietje, has kindly accepted to step in a very last moment, only last week. So Nils is working at the Behavioral and Cultural Insights Unit at the WHO Regional Office for Europe, and will present a study just published by his unit on the evidence of the impact of arts on health and well-being. So Nils, you have the floor for your presentation, 10 minutes. Welcome and thank you so much.
Thank you very much. I'm just trying to figure out how to share my screen. So if you bear with me for one moment, I'll see if I can just arrange for that. One moment.
You want me to share the video?
No, that's fine. I'm just, for some reason, when I click on the share button, it doesn't seem to give me my presentation, which I have in front of me. So I'm just going to try that now in the hope that you can perhaps see the presentation.
Now, perfect. We can see it.
Okay,
thank you,
great.
Neil.
Then let me just make sure that I can interact with it as well. Okay. Well, first of all, thank you very much for the invitation. I'm very pleased to have the opportunity to present here. I would say in the beginning a couple of things. My presentation today is really intended more to give you an overview of arts and health, a rising field of research, I would say, in this space and certainly within WHO, rather than really delve into too much detail about individual therapeutic components of arts and health. So I will say a little bit towards the end of my presentation, but as I say, primarily this is going to be an overview. Secondly, one thing I do want to say in the beginning, normally when we talk about arts and health, we don't really situate it in the space of traditional complementary and integrative medicine, TCIM, although I understand the rationale for doing it today, and I certainly think that some of the components of arts and health interventions very much fit into the idea of integrative components or integrative interventions. So maybe just to start off with, the question, what is arts and health, might need a couple of moments of attention. It's probably worth saying that arts in the form of stress management or arts in the form of healing is something that we've been engaging in far longer than we've had access to antibiotics or other biomedical therapeutic components. In the words of a famous French sculptor and painter, Georges Braque, art is a wound that is turned into light. In relation to arts and health, and specifically health interventions, arts can be thought of as, for instance, singing groups to improve pulmonary obstructive pulmonary disease, or dancing to improve Parkinson's symptoms that the patients are suffering from Parkinson's disease. And it's, as I say, an area of research that is increasingly receiving attention from researchers at various levels. So to reflect this increasing rise in attention at WHO, we published a report a couple of years ago, which really looked to achieve an overview of the research field in this area. So it's not a systematic review, as some of our other colleagues on this call today have presented, but it is a scoping review that's intended to try and map out the lie of the land and to try and identify particular interventions, perhaps, where the evidence is of particular interest and significance. So the scoping review considers all study designs and methodologies. It covers over 3,000 publications. And crucially, it looks at the evidence across the life course and the continuum of care. I think one of the things about arts and health interventions that are of particular interest is the fact that they are relevant both pre-birth as well as in palliative care, as well as to people who are not themselves the patients, but who are the carers of patients. Arts and health interventions can have significant impacts on all of these population groups. And I think that's probably one of the reasons why arts and health as complex interventions are particularly interesting to continue considering. The report that we published in 2019 highlights several, shall we say, areas within arts and health can be of particular interest. I've divided them here into two columns. On the one hand, we have the management and treatment of disease, and on the other, we have health promotion and disease prevention. And in both of those kind of categories, arts and health interventions can have significant impacts. In management and in treatment, for instance, there are acute conditions, like I've already mentioned, including COPD, where arts and health interventions have been shown to have clinical impacts. This relates also to neurological disorders, like, for instance, Parkinson's disease, non-communicable diseases, but also end-of-life care. But perhaps the area in which arts and health has had the most sustained and significant impact is in the area of mental illness and mental health. And this goes through the entire spectrum of improving or reducing stress, all the way down to treating, for instance, postnatal depression. And I'll say a little bit about that towards the end of my presentation. On the other hand, in relation to disease prevention and health promotion, arts and health probably have the kind of impact that we're more familiar with. Particularly when it comes to health promotion, the arts have traditionally been included on a kind of relatively simple way to engage people with ideas around how to behave or what to eat or what not to eat, how to conduct physical activity, to basically help engage people with their own health. This has been an area where arts have been very much used over the last decades. But increasingly, evidence is also showing that the mere act of engaging with culture and health, so cultural participation per se, can actually also have an important health benefit. So that means whether you're actively dancing or actively drawing or painting, or passively participating in the watching of a play or the reading of a book, all of these activities can be shown to have physiological benefits right down to the kind of level of biomarkers in the body. So the report that we published kind of tries to articulate its evidence along three recommendations or considerations, as we'd like to call them, policy considerations for policy makers to consider as they think about developing their healthcare systems or their health plans. On the one hand, there is the evidence. Our report does highlight numerous interventions for which there is very good grade A clinical evidence. For instance, in the arena of preoperative environments, it's been shown that doing something very simple, like playing music to people, the music that they've chosen, can help with the outcomes of the operation, but also post-operative healing. So something very, very simple like that, playing music to people who are about to undergo operations, can have a meaningful impact on their recovery without having any significant or any effects, side effects. So these are the kind of simple interventions which the report highlights, which we might want to kind of talk about and consider promoting. There's, however, also the important added value of arts and health interventions. That and this is to kind of highlight the fact also to cultural institutions that it may well be within their remit to think about the health benefits that they can have. So this could be relevant, for instance, in the case of museums, where it has been shown that guided tours that are specifically designed for patients who are suffering from dementia can have benefits from going to the museum and participating in these guided tours. So again, we wanted to highlight the fact that these cultural institutions may well have a health benefit to them, and that they might want to consider integrating those into their own strategic directions. And finally, I think an important point that our report makes, and that might be of particular interest to the policymakers in this room today, is the fundamental cross-sectoral nature of arts and health interventions and the arts and health movement. In order for these types of activities to work, in order for things like culture on prescription or social prescribing, as it is known in some countries, to be effective, stronger lines of referral need to be created between the healthcare sector and the culture sector in order for those two to collaborate more effectively together. So maybe just to conclude, I wanted to say a little bit about a pilot project that we are running. I won't say much about this because I have a video that I'm going to try to show, which is really far more eloquent about the intervention than I could ever possibly be. But just as a background, essentially, this is one of those arts and health interventions for which there is very good clinical evidence. It's intended for mothers who are experiencing postnatal depression, and it comes in the form of an organized singing groups where mothers in a group of 10 to 12 learn to reconnect and bond with their children and also with each other in order to reduce the symptoms that they are experiencing. We're in the process of putting together a trial implementation study for this in Denmark and Romania based on the work of academics in the UK who have successfully scaled this intervention to the national level. So I'm going to leave it at that, and I'm going to cross my fingers that I can share this this video. Give me one moment. Can you see my screen?
Yes, we can see the screen.
I think I might just need to make sure that you can hear my audio as well.
We cannot hear the audio, just see, but not the audio.
Okay, that's I'm not sure why that's happening. Perhaps Udo, do you, if you're familiar with the interface, is it something that you can try sharing on your end?
Yeah. I'm trying to share it. It's it should work. It's very slow today. I don't WebEx, or I don't know what it is. The screen opens. Apparently, it's working. It's turning and turning.
I've just tried again. Can you hear? Can you hear now?
Yes, we hear, but we can't see.
It was just relentless, the lack of sleep, and very calm.
I don't know if you can hear me, but I got booted out of the meeting. I think I overloaded WebEx. So
we can still hear you, but we can't see the content. The video, the YouTube video, we can't see.
yeah, so I'm sorry about this, but it's there we go. Okay. So maybe I'll just post the link to the video into the chat, and my colleagues can listen to that at their
Okay,
own convenience.
perfect. Let's do it like that.
Great. Thank you very much for the opportunity to present today.
Okay, now, thank you very much, Neil, for your very insightful presentation, and wish you to keep working to highlight the impact of ours on health and well-being. Now we are going to pass to, now I'm going to open the floor for a questions and answers session with the members of the European Parliament present. So whoever wants to ask some question, just raise the hand, and Udo will look who is raising the hand, and we are going to give them the floor.
Demonstrates how it should be. So I want you to really
Everybody can speak. If I don't have questions in the chat. You can.
Okay.
Who wants to speak? Who wants to take the floor?
Nobody. This means that it was so clear for everybody, I suppose. Well, if nobody is asking the floor.
Hello, says some speaker.
Go ahead.
Somebody wants to ask a question?
Yes, hello. Hi.
Valentina.
Yes, Valentina
Hello,
here
how are
from
you?
the MB Secretariat of the European Parliament. First of all, I wanted to say to all the speakers that this workshop was very, very interesting, and we are working together with Ms. Montserrat. We worked on the pharmaceutical strategy, and we also have mentioned in the report the integrative medicine, of course, always with, and I found very interesting also the use in particular in the oncology sector. So my question is to, I think it was Dr. Jorge Pérez-Calvo Soler, because in the end of his presentation, what it struck me that basically there is a need for more coordination at European level about this. So I wanted to ask all speakers, how do you think that it could be done at European level, counting of course, the responsibility of the member states on the health policies, but how do you see the future? What can we do in the European institution to help this more coordination at EU level? Thank you.
When Cara was born, it was just an overwhelming sense of isolation. It was just relentless.
I see.
Jorge, ¿nos puedes contestar? Sí.
Sí, yes.
Perfecto, thank you.
You see, some complementary medicines, of course, talking about integrative oncology is similar, but it's true that in some countries they are accepted, and in other countries they are persecuted or even banned. Then there is a very irregular way to see the integrative and complementary medicine depending of the countries. Then I think the most important would be to do some kind of scientific a committee for scientific evidence and to check the safety and efficacy of these different complementary medicines, and then try to do some kind of law to try to regulate at the European level, because it's true that there are, I think, there are ignorance or there are lack of knowledge in most of the conventional doctors about the scientific levels or the possibilities to use it, especially of course, in oncology, in the integrative oncology, which is a very difficult field in medicine, because maybe it's the more are the patients who suffer much, and and this is difficult because of the complexity of the illnesses. But I think if from the institutions it's created some kind of a committee to study in depth, deeply, which are these evidences in several kinds of complementary medicines, it will be the first step to be approved for the conventional colleagues that are not really very convinced that complementary medicine is useful, and it's very useful. I've been for 35 years doing, and I have many colleagues, and in chronic illnesses and in cancer, they have really very good results, especially with combined with conventional medicine. I don't know if I am answering your question.
I would like to say something also. I think that patients' organizations are also a very important actor in this discussion, and that they should be addressed, patients' organizations who have a word in this, because these treatments in cardiovascular diseases, for instance, are patient-centered. So you always have to have the opinion of the patient, and the patient has the right to use. We only have to inform him which are the evidence bases for the therapies. But we need the participation of patients' organizations also in these discussions at the level of the Parliament, of a group, if you want to have one.
Can I also say something? Yeah?
Yes, of course. Go ahead.
Okay. There are two things I would like to contribute. I know that the European Commission established the Knowledge Center on Cancer, and they invited stakeholders to contribute their input to this Knowledge Center. I'm in close contact with several academic centers where integrative oncology is provided. And so my idea in any case is to help these academic centers show them the way to the Knowledge Center on Cancer. And the other thing is that we as EUROCAM, we propose several amendments to the BICA draft report. I don't know if these amendments have been tabled in the meantime, but it would be well, wonderful if these amendments would be taken up in the BICA report that will be discussed this month, I believe, in the BICA committee.
Thank you very much. I don't know if somebody else wants to. Yeah, okay, Nils, go ahead.
Yes, thank you. So maybe a couple of points of reflection, and this is particularly because I tend not to be speaking in the arena of complementary and integrated medicines, traditional complementary and integrated medicines, and that's to say that I think this is probably an area that's increasing in size and scope, and treating it as purely monolithic may sometimes actually be a little bit counterproductive. So I would say, just as one useful step, breaking this big topic down into further workshops, into further kind of opportunities for awareness raising, into more specific areas might also be of use within the European Parliament. And speaking specifically, I mean, if we're going to talk about arts and health as a TCIM type of activity, a very specific set of challenges surrounds this type of activity, which is, as I was saying towards the end, the fact that it is inherently cross-sectoral. So at the moment, for instance, we see a lot of this activity being concentrated and centered in the kind of culture sector, or as opposed to the health arena, and more kind of cross-sectoral collaboration, even on the European Parliament level here between, for instance, the Cult Committee and the ENVI Committee, might be of particular interest.
Thank you very much, Nils. I don't know if somebody else wants to have the floor. If not, I'm going to conclude. Okay, so I'm going to conclude. First of all, just before I'm going to conclude and say thanks to all the panelists, after what Valentina was explaining, I think so as a map that we need a European common framework on complementary medicine, integrative medicines. Why? Because first, I think that we have to avoid intrusion and non-scientific, science-based therapies. So that we have in all around Europe a lot of misinformation, and the people, it's fear about this misinformation, and sometimes this misinformation arrives to the state members, I mean to the governments, because I was a former Minister of Health, and sometimes, you know, the people has a lot of misinformation. So we have to, I think that this framework could give or making people feeling safe with the complementary integrative medicines. And I think that we have to foster its use in the health public systems in all around Europe. But for that, we need this European common framework. That it is true that in the pharmaceutical strategy in Europe, that I am the rapporteur for all the European Parliament, we put these complementary integrative medicines on that. And now I'm going to answer Toni Nicolai about the big amendments. Now we have everybody, we put all the maps, we put the amendments. Remember that we put 1,500 amendments, and this Wednesday, so in 2 days, we start sharing the analysis of the amendment. So we have time, and we did not finish yet the report of Becca. So we are going to have 1 month more to work with all the amendments. I put one amendment of complementary integrative medicines, as I did in the pharmaceutical strategy. But in the same time, I think that WHO can help us too, to all the European Union, you know, to have this framework, because the most important thing is this medicine, this complementary integrative medicine, it's complementary to the ordinary, and then has to be done for the professionals, for the health professionals that they already study in our universities, of course. So to finish, thank you very much to all, you know, to all the panelists and all the members that they were with us today. We achieved to organize this last health working group workshop for this year, focusing on the impact of the complementary integrative medicine. It is the last of a program that actually went through 2 years, being affected by the pandemic and all the consequences that made very difficult the organization of the workshops. We hope that the next year, Sara and me, we can do these workshops presently with all the panelists and all the MEPs, because it's more easy to work together when we are all present. Sara and me strongly wanted this last workshop on complementary integrative medicine, having had experience, her, Sara, as a doctor, and me as a former health minister, of the broad possibilities of these therapies to contribute to the effectiveness of drugs-based medical treatments and to the well-being of patients with the whole support of scientific evidence and performed by healthcare professionals. So thank you to all the speakers, but of course to our team in ENVI and the committee's health working group, as Udo, that always you are helping so much to us to, you know, to do it real, these workshops. And I just want to remind that all the presentations of today will be available on the ENVI committee's websites, and a summary report will be available in a few weeks' time on the Parliament's internet website. So thank you very much, and see you, you know, in the next weeks. And thank you very much for all the panelists, because it was very, very interesting. Udo, do you want to say something? Go ahead.
Yes. Because unfortunately the YouTube video by Nils Fietje could not be shown. So if you want, I put it on the chat. You have the URL on the chat. If you wish, you can watch it for yourself, or I can send it to participants who wants to.
Or you can, Udo, perhaps, you know, because when we are going to close the WebEx, we are going to lose the video. Send us by email to all the maps of the group if you want.
Yes.